boards or commissions in their future and in their function at the local level and support increased capacity of the local mental health boards and commissions to develop a statewide vehicle for self-advocacy. Topics today that will be covered include increasing awareness of roles and responsibilities of the local mental health board or commission, basic information about duties and activities, adopting strategies for increasing effectiveness of the local mental health board and commission. So I'm Keris Myrick, and I'll be your trainer for today. I'm currently the CEO and president of Project Return Peer Support Network and the president of the NAMI National Board of Directors. I've served on numerous boards and conducted board, mental health system, and service training throughout California and the nation. And my background is in business, nonprofit, education, and organizational development. And I'm pleased to be working with CiMH and helping with these trainings. All right, so let's get started. So, if you think about your role, what do you think, what image in your mind, if you think about this and sort of put it in your mind, what image best depicts what you think mental health board service is or will be like? So how many people think that it might be like a student? Okay. How about an activist? Or how about a judge? No? Okay. How about a juggler? How about all of the above? Okay. Everybody on the phone considers themselves activists. Okay, so we have people also who consider themselves activists. So let's look at some of these and see how they might pertain to your role. So as students, you're probably always learning something new, taking in new information about your roles, responsibilities, activities, policies, and legislature. As I'm an activist, the activist over here, that you're supporting views as a local mental health board member, you're advocating for yourself and others, for the community, around issues that affect mental health treatment, outcomes, services, care, systems in the community. Now, as a judge, maybe it's that you're applying legislative bylaws and codes for sound decision making, so you have to make some judgment and think about some things and make some decisions. And I would dare say if you got to do all of that, you're a juggler because you have competing obligations, priorities, and info or information about your board. Also, you might have to juggle your personal interests against those that are for the community. So when you're on a board, it's really about sort of the community interest, and sometimes you have to put your personal interest aside. So if you've been talking to previous mental health board folks, who should be some folks sitting around the table with you, I'm wondering if you have heard what they wish they had known before they had gotten on a board. So how many have heard that they wish they knew more about the Brown Act? No? Not an exciting topic of information. Okay. How about if the people wanting to know more about their board roles and responsibilities? Yeah? Okay. And how about how to read outcome and data reports and use those reports? Okay, one. Are there others that people have heard folks say, wow, I wish I knew more about that? Yes. Rules of order for conducting meetings?
Like Robert's Rules of Order.
Like Robert's Rules of Order, right? Okay. Anything else that they've heard? Anything else, you all? No? Marty?
How to effectively intervene after you've made a judgment, you know, or decide this, that, or the other thing. How did it not go down the drain?
Okay, so how to make sure that after a decision is made, it's actually carried out?
Well, we moved ahead.
So that you moved ahead on that decision. Okay. Yes?
One of the fears of influence, how do we take all the information that we're mulling over and
Okay, great. So impacting community change with the decisions that you've made so they get carried out and filtered down all the way through. Yes?
I think it's really important to have clarity on what the responsibility is of the board and the authority, and understanding the limitations or the muscle.
Okay. So to be very clear about the roles, responsibilities, authority, and power? Okay, great.
Remember, they all have responsibility.
Okay, so I've also heard a lot around roles and responsibilities. Thank you. So as we unpack our box of all the stuff that we're going to try to focus on today in our 101 training is we're going to learn about increasing awareness of the roles and responsibilities of the local mental health board and commissions, gain some basic information about those duties and activities, and adopt strategies for increased effectiveness of the local mental health board. So let's see, we're going to do a little fill in the blank, and on this part of your screen are the possible answers that you can use. On the right side of your screen here are the possible answers that you can use to fill in blank 1, blank 2, and blank 3. Yes, you actually have the handouts in your. Anybody have the answers? Yes.
Legislature.
Okay.
Of the people's business.
Okay, great. So the legislature finds and declares that the public commissions, boards, and councils, other public agencies in the state exist to aid in the conduct of the people's business. Okay? Great. Now we're going to see how that actually happens. There we go. Forgot I could put the answers in there. So there are the answers. All right. So this goes to one of the things that people said they wish they had known. In one of your handouts, there is a welfare and institution code handout. It's a 2-page handout.
Right-hand side of your screen.
Yeah. All right. So let's look at a couple things. You're not going to look at this yet, but I'm going to have you kind of go through it with me. So the authority, obligation, and relationship based on the Welfare and Institution Code. Can you all find for me where on this handout that you have, you see is a citizen board mandated by state law. Members are appointed by the local county governing body or board of supervisors. Is advisory, it's also advisory to both the board of supervisors and the local mental health directors regarding any aspect of local mental health programs. Where do you see this on your sheet? Might not see the exact wording, but you'll see the essence of what it's saying. So 5604A, A1, okay. Talks about the first 2 bullets. What about the third? Which one? Which G? Okay, mental health board may be established by an advisory board or commission depending upon the preference of the county. you see 5604.2A3? Again, advise the governing board and local mental health director as to any aspect of the local mental health program. So these are really good to keep handy because this helps you and you can use it as a guide. And yes. Oh, okay. Yeah. So what you can do is you can actually, we'll delve in a little bit deeper. Sorry, there's more down here. Sorry about that. Okay. So there's more down here. And we'll delve into this a little bit deeper. And rather than me kind of pointing it out to you, I want you all to get used to actually finding the different information in the codes by using this little handout. So we'll look at another slide where you actually have to kind of go through and find exactly where some things are. Yes?
Could you just for a moment, 50% of the board members shall be consumers of adults, adult children, at least 20% shall be consumers and at least 20% family members. Could you just say a word about that?
Yeah, so this just is the number or percentage of what the board should be comprised of. Okay, so you should again have 50% of your board who are made up of any of these, which could be consumers, parents, spouses, siblings, or children who are receiving or receive services. And then specifically, at least 20% of the total membership shall be consumers, and at least 20% shall be families of consumers. So that's just, the way I always look at these things is that is a starting point. So it could be 25%, right?
What if there was difficulty recruiting, for example, consumers?
So, yeah, so we're actually towards the end of the presentation and the training. We're going to go over recruitment and membership and come up with some maybe challenges that you've had with recruiting members, especially around diversity, people with lived experience, or consumers, and then what possible solutions that we can come up with together and do some brainstorming around that. Okay, so I'll put that, it's already there. I'd say put it in the parking lot, but it's already in our presentation. Okay? How do people feel they're doing in that area as far as having your 20%, 20%?
I think we've had quite a while now of getting 20% consumers. The other groups seem to be okay. This is my impression now. A number of years ago, quite a while ago, we decided not to make public the we keep a record of it. It's not on the public record which type of equipment you are. And we thought that would help, but I don't think it helps much.
Interesting. Yes?
And maybe discussion, there could be a little discussion about, I think there's a concern about stigma and discrimination.
Okay.
Self-identifying, and maybe just some discussion around that.
Okay, so some discussion around pros and cons of identifying and how to recruit consumers or people with lived experience because they may, worry about discrimination, stigma in their life outside of the mental health board. Okay, great.
And I would add that making it a safe way for people to be able to participate, and if that's or self-identifying. From my experiences working with another county as an employee, and that was something. So I think that's up to us to sort of create that environment for our members.
Okay.
The other issue is this: the county has been so successful in finding positions, paid positions for consumers or for previous consumers, that the Brown Act or whatever it is interferes with their recruitment because they're working for the county and they're the most active consumers. And we don't, as our understanding, they should not be coming to board members because they're receiving the conflict of interest.
Okay, so actually, we'll get back to the Brown Act since it's right here, but I had a hand up in the back and I can't see your... Okay, all right.
That's actually the W&I code here.
The W about the conflict of interest. Okay. Which one is that?
It's D on page 1.
Okay, so D, so no member of a board or his or her spouse shall be a full-time or part-time county employee of a county mental health service, an employee of the State Department of Mental Health Care Services, or an employee of or paid member of the governing body of a mental health contract agency. So as people with lived experience and consumers become employees, it becomes harder to find people who are eligible, even if they self-disclose. Okay, great. Yes? Mm-hmm.
I get very close to that line, actually.
Okay.
But it's a different county.
Okay. All right, so I'm just making notes that we can delve into that a little bit deeper when we get to the recruitment and membership part. Thank you. Okay, so in your folders on the right and as attachments for other folks, you have this great little pamphlet here, which is the a pocket guide to open meetings law in California, the Brown Act. And if you need to download it, there's the link right there. So the Brown Act is the law which guarantees the public's right to attend and participate in meetings of the local legislative body, and it governs the actions of the local mental health board and commissions. How many people feel fairly comfortable with the Brown Act? We're going to go in more detail a little bit later. Feel pretty comfortable with it? Okay. Are there any questions that you have about it that you know, we can, when we get to that point and we go through again using this little booklet, this little handout, we'll go through one by one. All right, so let's move on to roles and responsibilities. Okay. All right. So these are your purpose, powers, and authority, and this is, you had mentioned earlier, related to the purpose, powers, and authority, that it's really important for board members to understand clearly exactly what those are. And so again, if you go back to your California Welfare Institution Code page, this one, now we're going to walk through it a little bit more. So review and evaluate communities' mental health needs, services, facilities, and special problems. What problems or programs? Let's see. Where do you think this is? Can you find this on your sheet?
This problem, A1.
Okay.
Problem.
Okay, great. Thanks. Just making sure. Okay. And then our next one. Any questions about that? And we'll go into what the activities look like when we go a little bit deeper. So we're just going to go one by one so that we're clear about what the purpose, powers, and authorities are. So you're going to review and evaluate the community's mental health needs, services, facilities, and special problems. Review any county agreements entered into pursuant to the Welfare and Institution Code Section 5650. Going to advise the governing body and the local mental health directors as to any aspect of the local mental health program. Following along where all of this is on the code. Okay. Review and approve the procedures used to ensure citizen and professional involvement at all stages of the planning process. What do you think the next one's going to say? What do you think? I'm going to get ready to hit another bullet point. What do you think the next one is going to say if you've been following along on the codes? What do you think the next one's going to say? Okay. Which one is that?
That's number 5.
Number 5?
56042A5.
So 56042A5. And? Yay! I wish balloons or things would drop or we could give away prizes or something. Okay. All right. So again, if you find that you're not doing this, how would you use this these codes and or this form to help make sure that your board is doing these things? Yes?
That's when we're talking about our agenda and what we're going to be doing. It would help another program that comes up without any kind of goal in mind for that.
So when you're setting up your agenda or having people come and do presentations, it doesn't seem to be tied to anything, and you're kind of going, okay, that was nice, and what's the purpose, or how does this align with our authority or what we're supposed to be doing? Okay, so you can use these to actually kind of almost create a grid or a roadmap of what you're going to be doing according to your charge. Yes, Marty.
Well, I was just going to say that the board recently, on this, since 2008, has focused more on education purpose. I think I was described well. People are coming, they do presentation, and then we know that. And it doesn't seem to lead to any action. That was going back to my earlier point.
Okay.
How do we move things forward and so on? We don't seem to be doing that.
So you're saying that people are invited, they make a presentation, and it feels like it's for educational purposes? Yeah. Okay. Could you look at any of these and think of, if somebody's coming to do a presentation, how might it tie into one of these purposes?
Well, it certainly could tie into the first, knowing to what extent, giving us enough data, not just education, but to evaluate the program in some way.
Okay.
So
okay. What about the third bullet point? Could it do that?
No, there's something added to here that I wasn't aware of.
Okay.
I've done it many times. I knew we were advisory to the Board of Supervisors, no question. But I didn't realize we were advisory to the local mental health director. I thought we had a more instrumental role in terms of benefit. In other words, the board could more than just suggest, advise that they do certain things, but we had a way of causing implementation, and the words are different.
Okay.
You know what I mean?
So you saw, you're defining advising as, I'm just kind of giving you this advice or heads up versus actually being able to have more power to implement something.
You have to do this as opposed to suggesting this.
Okay. Okay. Yes, it can have that, especially when you do your annual plan or your plan at the end of the year. Yeah. Okay. Yes.
The several mental health boards that I'm familiar with have operated more on the process of the mental health director coming in and telling the board what's going on. It's kind of a one-way communication. There hasn't necessarily been a part of that where they solicited how do you think you're doing with this now that you've heard all the things that I'm telling you. And the next bullet, which isn't up there on review and comment on county performance outcome data and communicated findings to California Mental Health Planning Council. That second part of that I knew nothing about. But we tend to get information on a particular service and get told all about how a particular service happens. We don't get data on the system overall.
Okay.
There's very little on the outcome. And so then there's really nothing to comment on.
Okay.
And I know I'm talking that, but no.
Want to make sure. So what I'm hearing you saying is that for 5604.2A6, this is a new information that part of the roles and responsibilities is review and make recommendations on. Is that what you're saying? Was it 6? 7. Sorry. Review and comment on the county's performance outcome data and communicate its findings to the California Mental Health Planning Council. So
I'm also 3.
Okay.
Advise the governing body and local mental health director.
Okay, great.
I'm going to jump in on the data part. I'm familiar with CiMH and I oversee this project, and we are working with the Planning Council, and the Planning Council has a mandate to really do some expanded work around working with mental health commissions around data. and they have been developing what's called a data notebook. Our plan is, there is one face-to-face conference that we'll be doing in April in Irvine. The registration will be free, but the travel costs are up to the individual, the county, or to the individual commission members. But it's going to be a one-day training related to this data notebook process. It's new for them. They've been working on it for a while. But what we hope to do is to be able to give you some tools and information that will help you with this, working with your mental health director and staff, and to understand more what are the data and outcomes, because it hasn't been as robust as it needs to be. I would say that. And I also think that this is something that really varies from county to county, based on the size of the county, based on what your county looks like. You know, we say we see one county, we see one county. So hopefully by when we do the training in April, which you'll hear more about probably in the next month or so, you'll be able, if you can either come to that or the information from that, there'll be more information with the plan, and we are working with the planning council on that. So,
will there be a dialogue capacity or webinar for that, or something like CiMH to repeat that in Northern California? Because, you know, if it's really, we don't have a budget.
Sure. It's in our contract to do it as a face-to-face contract, but if there's a way we could videotape it potentially and put it online, we'll consider that.
Okay.
Sorry,
yeah.
You give presentation of statistical type tools.
You know, we're just starting. I don't have the details for you yet, but we will. They have been doing some work about how to present this information, and so what the data is. So I don't know a lot more about it, but we'll have more to share.
Okay. So, and there's more. So when we got to 6, probably 7 is there. Yeah, review and make the recommendations. There's the one around data that we've just talked a little bit about. And it's so funny because in my notes it said, point out future training on understanding and working with data. So Kim has done that for me. Thank you. Okay. Yeah.
What about the approving the MESA funding? The MESA contract comes to the mental health board here.
Oh, right. Okay. Yeah, that's here. We didn't cover that because it got covered, I think, training after training, so we didn't really cover that. But yes, there is that part as well. So about the Mental Health Services Act funding.
So it's
reviewing the Mental Health Services Plan.
Right, the annual plan for Mental Health Services Act.
And then they make recommendations to the oversight in the county. No. Okay.
County mental, they review the county the annual Mental Health Services Act update and hold a public hearing on it.
Is that on one of the
No,
it's not. It's basically sort of embodied in this. It's not detailed because the WI codes haven't changed. Dan, would you have anything to add to that?
Over the legislation of the Services Act, where it says that the public hearing will be held by the local mental health advisory board.
Right.
Different citation. I don't have the number. Sorry.
So can I, let me see, this is why I see there are experts in the room too. So as far as the legislation for the Mental Health Services Act, it would be in the act around what the local boards and commissions would be doing, holding the stakeholder process and giving the feedback. Is that what I'm understanding?
Convening the public hearing.
Convening the public hearing. Okay.
all the MHSA advisory here, you know, all that stuff has to ultimately have to sign off of the local mental health board.
Yes. Okay, great. Okay. That's your other duty as assigned. Plus others, I'm sure. So the other thing is that a lot of stuff that is in the welfare and institution codes, there's part of it that does say, you know, this is not all encompassing. You know, there are other things that you could be doing or required to do. Oh, that went quick. So we can either take a 2-minute break or we can. You guys don't need a break, do you?
Or just power through and let's keep going.
Just power through. Okay. All right. Oh, let me just say, I love this quote, and I think it really speaks to the fact that there's so much information and so much going on that it's going to be really hard to be perfect at everything. You know, in the student role, in the learner role, activist role, juggling, you don't have to be perfect. You just have to give your best effort. Okay. So we talked about just now some of the duties and powers. And on this left side on where it says duty, it says match 4 duty to activity. So the first duty is evaluate the public mental health services to assure that they will meet the needs of the community. And the second one is to advise the governing body, Board of Supervisors, and local mental health director as to any aspect of the local mental health program. On the right side are activities that would match with these. Which one matches with which? Does activity, does duty 1 match activity 1 or activity 2? Activity 2? There you go. So we're talking about having the presentations and people come in and it feels like maybe it's education, but that can also be about the evaluation piece too. And I guess after they have the training, it'll be much more apparent and clear how that works and how that might tie in. Okay, so then of course the other one would be advise the governing body. So you would review and comment on community planning processes and plans. So, for example, you could be encouraging community input at meetings, inviting people to come to meetings. This is where Brown Act, of course, all of your meetings are open to the public. Okay. What other duties do you think there are if you looked at the Welfare and Institution Code from, let's see, 5604.2, which is where we were just now? Yes.
I have a question for a long time that perhaps is about to bring it in. Is the board clearly the board interacts and evaluates instead of a public mental health facility, the county mental health facility? My question became, to what extent does the board have any authority at any level for non-public mental health services in the county? Local services that are not. For example, when the education system was given the authority to present services to children, well, obviously that was made in Sacramento and so forth. But would we have any authority to kind of say how this is going to impact, the mental health of the community? Would that be our concern? Or if a certain program is not doing X, Y, or Z, it's not public.
I mean, I think under the code where you're supposed to be also looking at the community needs, if that's a community need and it impacts a community need, then I would see that it falls under what the local mental health board could address.
That was my impression. But
then, much of the county mental health services money goes to contract with the county.
Yes. But that I understand. But there are many, it's not going to be, let's take the issue, well, it could be a particular aspect that doesn't really involve.
Any county money.
Yeah. For example, I'll give a good example. What if in this county with no ability, the private physicians do not want to prescribe psychiatric drugs, or people working in contemporary psychotherapy can find someone who will prescribe drugs for their patients.
So you're talking.
Authority in that situation.
Wow. That I don't know. Yeah.
The first part about mental health services being provided through the education, I think education is public. I think we can review and comment.
You do?
I do, because it's mental health services that are being conducted through a different entity, but with mental health services, I would think we could at least comment or review outcomes and comment. May not be able to influence how it's carried out, but that's public. If you have a private hospital or that gives no government funds, or private visit, or I mean, you can hear complaints from members of the public and say, there might be an issue here, but I don't think we really have, and we could identify a gap and a need, but I don't think we really have any kind of authority to do visits or investigate or, you know, have them come and report to us. They're private.
Thank you, Al. I mean, that's very helpful. Going back to the first point, though, I, particularly, I'll speak for myself, felt very strongly that the fact that the conflicts in providing mental health services in the county to children could be compromised, my own feeling, by assigning it to the education where it competes with everything else on this budget restraint that the education system. And I think I was told, well, we have nothing to say about that. In other words, to what extent are they providing psychotherapy, individual psychotherapy to children who clearly in need of it? That's the kind of, and I felt silence in terms of that because it wasn't.
But if you think about it, if it's about assessing community needs, then it is there's people who are falling through the cracks in the private sector or the public sector. That's for us to identify, and we do have safety nets for those kids who aren't being served through the schools.
And I also think with the Affordable Care Act and a lot of people who had no kind of coverage now perhaps being enrolled in Medi-Cal, and more providers then accepting that as an insurance mechanism, and that broadens, you know, to the extent that more providers are accepting that line rather than all private insurance. I think you have to file something. I think you have expanded opportunity to look at those providers that are taking public forms of insurance.
And not to belabor this, but it's almost a good example of the fuzzy line. So the transfer responsibility to provide mental health services to pupils with special needs is the starting point, and then the next is for those children who are Medi-Cal beneficiaries, the county can step in, as we have been in the schools, and providing the services we think are no longer occurring. We can. I think then it goes over to your first question, Marty, because what about all of the children that have private insurance or commercially insured and aren't part of the county safety net? That's probably a good example of how far out do we go in our thinking.
Any other comments or questions or any ideas about or questions about some of your duties and activities that might be aligned with those duties?
How about
We're talking about Medicare, so do you think, so Medi-Cal, so we have, as the advisory board, authority in that area? In Medi-Cal?
Mm-hmm.
Oh.
Yeah. Related to mental health, sure. Any other? No? Okay. So I'm just double checking. So what are some of,
I would just add something here. I think perhaps the way to consider it is to maybe include, maybe inviting local education if they're willing to participate or to present at a board meeting at some time, a commission meeting. And perhaps something one you might consider is trying to recruit somebody as a commission or board member who might be from that system. Just something to consider.
yeah. I think that's a really good idea. So. All right. So let's look at a couple of other of your duties. So you know, some of your performance duties, for example, you know, is reviewing state hospital contracts, reviewing performance measures. Of course, we've just talked a lot about that already. Presenting to the Board of Supervisors. Are folks doing that? Yeah. Oh, and I'm not in the paper. I'll let you know when I'm in the paper. So I'm just giving you some ideas that some of your duties are kind of in these categories of performance, Board of Supervisors, or community forum. So like for being in the community and finding out about community mental health needs, attending health fairs, making presentations. Are a lot of folks making presentations also? Interesting. No, I don't. So I'm just going to speak honestly. I've not seen anybody, a board of supervisor. Okay.
We haven't in my tenure on the board, we haven't my 2-year tenure on the advisory board. I'm trying to recall if we've taken any advisory positions and asked them to come to the board of supervisors. Maybe one or two, one on the actually the merger, the relationship between the drug and alcohol board, and I'm trying to think of what else, but there hasn't. I mean, I try to bring to the board and use that public forum if I think there's an item we're discussing at the mental health board level that would benefit from some sunlight, sunshine at the larger public level, but that's pretty much how we use the board in my tenure the last couple of years.
Since my gratuitous comment, since my tenure goes back way before Katie's, Katie, Ronnie's our supervisor, has been by an enormous amount the most present board of supervising members since I've been on the board in 2000. Thank you, Trina.
Thank you. And how many people are doing site visits? If you're getting feedback and you're doing site visits, and what do you do with that information? What happens as a board member? You bring it to the board. Okay, and then what does your board do with it? It's education. Go ahead.
I didn't get to go, but one of the recent site visits we picked because of the issue around do we have enough psychiatric beds in the community and what other resources are available, and is the opening of this new, what is it called, crisis residential facility going to help address a need that's being identified. Otherwise, is, oh, we don't have enough of this. Will this new facility help ease some of that concern? So that was kind of the purpose behind the visit. There is a template that we're supposed to fill out for a visit. I didn't really review it and see if it was meeting the need that we thought it should, but we have brought our impressions back to the board meeting.
Okay.
So,
all right. Great.
and we did go through a whole long process of whether we should take a position on the community request, and so this was feedback into that.
Okay. Thank you. What other activities have you all been engaged in on your boards? You do site visits, you have presentations, of course you're attending meetings. What else? Great.
As an outcome of presentations, we also, and/or members of the public who are attending meetings and raising concerns, we actually have responded to those by doing some investigation and interacting with the service provider and with sites, specifically the jail, when we were having issues. People raised the issue of inmates, residents, not being able to navigate the system in order to make contact, regular contact with people on the outside. So, you know, I think actually we've made some concrete contribution to the mental health needs of the community, based on those presentations that we have and community input.
Okay, so based on the presentations and community input, use all of that information then to guide what you're going to do related to, yes.
So I have a question for the group. So do you do any kind of annual presentation to your board of supervisors during maybe May is Mental Health Month or something like that? Is that something that's ever been, or maybe presenting your annual report or something to consider down the road?
My memory isn't good enough, but we certainly have had years where our annual report was presented with more forcefulness, people know more than other years. Whether, I think at one point, Gary Shepney was chair of the board, did present it to the board, but I
current example is Robbie and another commissioner, Gary, really started focusing on suicide prevention, particularly around areas on the Golden Gate Bridge. And they did some individual work outside of the board, but then came to the board and basically got that particular issue incorporated into part of the strategic plan for the year going forward. So I think that will result in a lot of advocacy and more public awareness sorts of activities.
Okay, great.
The other thing is that we have a lot of individual members of the board on other committees that are related to our work. So I think there's a lot of activity that happens outside the monthly board meeting. And then we do get reports back. Committees on homelessness. Marty, you've been on data and prevention committees. Robbie's on about 20 different things.
Okay. And so you're able to be on other committees and then bring information back and forth to both the committee and to the board work that you're doing. Great. Okay.
I would really like to emphasize that because the number of the Mental Health Advisory Board members are committee members that are actually doing a lot of work, and including sitting on the county mental health quality improvement committee, and then a whole variety of other committees as well, CR prevention, education, et cetera.
Okay. And within your annual reporting, do you also highlight success stories? A lot of times, I see annual reports and it's just, well, here's the problem, kind of everything's a nail and we're going to hit it with a hammer. How often are you able to find something that is happening that's great and reporting out on something successful? Does that happen?
Just writing this year.
Okay. Yeah, some of you haven't been on the board long enough.
Really around working on last year's report that we were. Yeah. Right. So we kind of take the issues that we put up as issues last year and then report on progress and then design new things that we think we're going to be looking at.
Okay. Great. Thanks. All right. So our roles and responsibilities provide the foundation for how mental health board members identify their primary duties, and those are the duties the House boards live within. It sort of gives you a frame and a structure in which you are going to operate in. So if you had to answer this question, just take a moment, maybe want to do a little bit of a round robin. What do you see your primary duties? What are they? So, gone over them.
I think general advocacy, so far as I've seen, is we're able to go into the different organizations and link people up, almost just being present seems to be what I've seen so far.
Okay.
I think a primary duty is, in fact, to give advice on the functioning of the various services, advice to the mental health director and also the board of supervisors.
Okay. What else?
Yeah, I joined the board primarily because I really wanted us to, I thought the role was to review sort of the bigger system, identify needs and gaps, and work on strategies, advising the county on what kinds of things they should be doing moving forward. I'd love to be doing that. I don't really feel like we've been doing that.
Okay. How can you use some of this information then to, so Alice has said, whoops. So you've indicated that, that identifying needs and gaps and thinking strategically about how to make some changes and impact that, and you don't feel like right now that might be happening to the point that you would like it. So how can you use some of this information, do you think, when you go back to say, well, here are some things that we're really supposed to be doing. Have you thought about maybe some ways that you would use either the codes or information you've heard from your colleagues?
I think a lot of counties have put a lot of energy into the LMHBC planning process because it's very prescriptive. You must do these things in MHSA, at least at the outset. So I think less has come back to the board to do a lot of that planning because so much energy is going into these other things. And I think we've had that here too. There's a lot of planning meetings that happen out of my ability to attend because they're during the day or they're out in Bolinas or something. And I just haven't been able to go to these things. So my thought would be nice to have a little bit more direct input from the active planning processes that are happening at board meetings, or maybe we have a retreat that goes over, what these broader processes have found so that we can really kind of churn a bit on what is that, what do we think the board could do with that, and how can we be helpful, because I'm kind of feeling left out of that loop.
Okay.
Yeah, I think one of the things that I found that affected board activity since 2010 was the severe budget cuts. I think the board, when I came on to it, just prior to that, and the board was forward-looking. It was in a sense of what do we need, but don't get hit with these massive budget cuts. It's a question of survival for programs. The issue of new programs went to the background. And I think many board members, potential board members, didn't continue on the board because there was no potential. There was no budget for really moving things forward. And I think that affected, really seriously changed the function of the board.
Okay. I'm going to add retention to the recruitment slide. So maybe we talk a little bit about retention. I hadn't thought about that. So, okay, great. Let me just find that slide so I don't forget about it. Before we go on to the next one, can we go ahead and take a 5-minute break? Okay, great. Thanks. So it is, what time is it really? 11:04.
So we'll take a 5-minute break.
5-minute break. Thanks. There it is. Okay, so welcome back. Now let's look at some of our duties. We talked about the primary duties. Now let's look at how our duties are compared to your requirements and things like that. So this is Fido. I don't know who Fido is. It's just a picture of a dog from clip art. He was very cute. And of course I say duty to my dog and it means something completely different. It means go outside and do your business, but that's not what we're talking about here, right? So really this is just like how dogs are very loyal and caring and loving, unconditionally so, and then as humans we have this responsibility to be loyal and caring back to our pet partners, our pet children, if you're kind of like me. So as board members, we also have a duty of care and loyalty to your mental health board and commission. So attendance, ensuring that you're attending meetings, of course letting people know if you're not able to attend, that you've taken your ethics training. So AB, I don't know, this is AB 1234 requires that all local mental health boards and commissions receive ethics trainings every 2 years. Did you all know that? Okay. You never heard of it? Are you guys being facetious? So he's been on this, you've been on the board 5 years. Okay. So you might want to take note that you're kind of due for your ethics training. And you can get one online. You know what? I should have, my bad, I should have put the link here. So if you do, I can give you guys the link, and you can put it in.
What we can do is that after this training next week, everybody who signed up for the webinar and got the materials electronically, we will forward all those to you too, so you have them for your records, and we can add any links that.
Okay.
Does that seem okay?
Yeah, that's an easier way to do it. Okay, so and when you take this ethics training online, it's free. It prints out a certificate that you've completed the training, that if you ever have to produce it, voila, you have the proof that you've taken and completed the training. So of course you have to have familiarity with the laws, and we just went through just really a handful of the welfare and institution codes. There are many more actually that pertain to the mental health and mental health systems realignment. And then we talked a little bit about Mental Health Services Act, and there are other, of course, legislation that may come up related to mental health stuff, as I call it. So where do you guys obtain information on any legislation that's upcoming? Where do you get it?
Mental health director.
From the mental health director. Oh, she's like, I'm not saying anything. Okay. And where do you get it?
Well, let's see, I find it really valuable to stay active with the California Mental Health Directors Association. There's a legislative committee almost every week.
Okay.
Where we're advised of all the upcoming legislation, the different positions being taken, and then those that are particularly pertinent are moving forward. I really try to incorporate in my monthly director's report and then talk about it during the meeting.
Okay. And if folks want to do it on their own, can they use the California Mental Health Directors Association, or should they be using the California state, the CSAC? There's a legislative tracking page there as well where you can put in mental health information.
I think that CiMHDA through the directors probably provides the best
sort
of a good way for communicating what's really relevant to the local county mental health system or behavioral health system. Suzanne, would you agree on that?
I would agree, because there are actually people there in Sacramento who are, participating in community meetings, et cetera, and then they're sort of reading the legislation, the different positions, and they're summarizing those that are pertinent to community mental health.
Okay. Thank you.
You can't go and look as a member of the public at the summaries of the CiMHG pledge matrix. I mean, all that. I know because I'm on that, but you have to have a link to get to the document, the handouts for those meetings. So I think it all has to come through reports from the directors. It all has to come through the reports from the directors. Okay. The CiMHGA website also has a lot of information too, and it's got it by committees, and there's a lot of public information there that I think there's also a breaking news link on that, and the website there we have it in our slides, but it's cmhda.org, and there's quite a bit of a trailer. I've often found things that I'm looking for, and I don't have a login, and but yeah.
I think the breaking news is a public access, and that has sort of what's hot news breaking. And then there are a couple of other spots that are public information there that you can go in and look up. The monthly newsletter that comes out generally highlights active pieces of legislation that are about to go through, have gone through.
Okay.
So there's a portal.
And do you, oh, go ahead, Keris.
I was just thinking also something that I subscribe to. This is more national level, but there's the National Council for Community Behavioral Health Care, which is an advocacy organization out of Washington, D.C., but they have a very active
So we're going to have everybody come on back. Okay. And we're also going to open up the phone line so that people who are on the phone can participate along with us. So, which group would like to start first?
Or what about some of the folks on the phone?
Nobody's raised their hand yet.
Oh, okay.
Yeah. They have to raise their hands to be sort of, they're not collectively unmuted? Oh, okay. All right.
Okay. So we actually have done a lot of work to try and recruit members from different areas where we feel like we're underrepresented. But we've had challenges with that in part, I think, because of our functioning and our mission. There's been concern that we're not as active and out there and doing things as perhaps boards have been in the past. So, perhaps re-examining our functioning and our mission and our action might help with that. Also, though, there are different communities that we have had trouble recruiting and retaining, and there is a new, I can't remember the title, there's a new cultural competency director or ethnic services director, I'm not sure, in Marin that we're talking about reaching out to see if some of the official activities in town of Marin to bring in more representation could be spoken to help get volunteers to be on the board.
Okay, great.
It was sort of all over the place, but I think one thing we took away was that in order to make recommendations effectively, to have a direction and something to carry out, and that's very important for retention, because if people come on, in order to be able to make recommendations, to be active, you have to be on the board for a while. So we wanted, so if we give the board a better direction, then we can have better retention, which would in turn, make all these other things better. More experienced board members.
Okay. So what I heard you all say earlier, so I'm curious as to, I am not hearing it now, but that's okay, is you said it was difficult to recruit folks who have lived experience, consumers. Is that what I heard? Okay. Okay.
I mean, we're not really aware of, well, I'm not aware of what the makeup of the board is. So I have no idea.
Okay.
It's part of the, I guess, the choose the bylaws, so it's not public information, and there's a clerk who has that information. So in terms of recruiting consumers and things like that, I really have no idea. And I think that it would be good to have that makeup given to the board so we know if we are in compliance or not.
Okay.
There is an official list of it, and we have access to it. It's just not on the web for public access. So I think the chair should know who's being represented. I mean, I don't particularly know myself, but I think the information's available.
Okay. So, Dan, I see.
Some counties,
Yeah.
what I've seen some counties do is when they're recruiting, when there's an opening. So I think District 1, District 2 has an opening for a family member position or a member at large or a consumer, or so it's sort of sometimes in your recruiting, maybe that's a little bit more deliberate, and I know many boards of supervisors keep a general page about all the different, advisory seats available, and not just in mental health or behavioral health, but throughout, there's just something that might be one way to sort of be a little bit more deliberate about recruiting different types of folks. And I think, Suzanne, did you want to offer something?
Well, I'm not a member of the board, but my personal opinion is if we could move forward so that consumers and family members feel comfortable in stating their lived experience, because I think when people speak from that voice, it's very powerful, and it really does help destigmatize. It really does over time, because then people are seeing it people, and initially that's difficult, but then you move on. And so that's just, for me, a personal thought.
Okay, so creating environments where people are welcomed and helping to reduce stigma. So have people brought in maybe folks who do talk about their personal stories and have ways of doing that who do not work in the mental health system?
We were just commenting how the majority of our board meetings do have family members, do have consumers, but they're not members. And I haven't, the three of us here have not been members of the board very long, so I didn't know if there's, that we've asked them to be members or that they've got a conflict so they can't be. I don't know, but it has seemed curious to me that we definitely have local members of the public that are coming to every single meeting, but not as board members. I mean, there might be one or two people, but there's no cultural self-disclosure. It's not like anyone, when they speak, any members in the board, when they speak, that they say, well, I'm representing, I'm speaking as a recovering alcoholic, or I am speaking as someone who struggled with depression. There's none of that. That doesn't happen at all amongst the members of the board.
Amongst the members of the board?
Yeah. No one, when they talk, they just talk. And we only get a little bit of background on people, in my experience, when they first join the board and someone says, oh, Robbie's now a member of the board. Can you tell us a little bit about yourself? And so for that one meeting, we've heard from Robbie what his background is and why he cared enough to sign up to become a member of the board. But that's only with new members. I know nothing else about the people sitting around the room unless they say, well, I work with people who go to jail or, whatever.
And so have people tried, for people who do feel comfortable, are they modeling it all? So it's not even happening even in a modeling way, so that if there is somebody who has lived experience, being able to even help people have a little script about how do you, with intention, so you're not just saying it for the sake of saying it, hi, I'm so-and-so, and I'm speaking from the lived experience perspective or whatever, but maybe with intention around this issue of, and I've, in my personal experience of trying to access da-da-da-da-da, I mean, has there been any type of training about how to intentionally help or speak out?
There's no been training as far as I know about that, but we certainly have had very local consumers very much spoke point from their point of view. I'd say a couple of years ago or so, maybe a little less, the most recent left. But prior to that, we don't, a person who very much represented the consumers in official village now. We haven't had that at all, in my opinion.
Oh, is there, I have a hand up? Oh, go ahead.
Marcia, you're unmuted.
Hello, can you hear me?
Marcia?
Marcia, yeah, can you hear me?
Oh, hold on a second. I'm going to turn up so I can hear you better.
Okay.
Okay, go ahead.
Okay, so on our board, it's very similar to what someone just spoke about as far as people not really introducing themselves as being a family member or a client or anything. But I think after this discussion, I'd like to bring that up because I have no idea, who's who. But I think it'd be good to know.
Okay, great.
Great.
So maybe at board meetings doing an introductory exercise and having someone who can model it and saying, in the introduction, please say your name, your role, and perhaps your relationship with mental health issues. So the relationship could be, I'm a person with lived experience, or I'm a family member, my uncle has, blah, 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 so that maybe that gets at some of that relationship piece. And also the relationship could be, I'm a provider of mental health services. That's fine as well. But I do think, it is, especially sort of in that public forum way, hard for people to disclose if they feel, in fact, it may impact their personal life in a different way. So I think, again, I don't, finding folks who may not be, known in the mental health system to be able to come and speak about their lived experience and how they talk about it, who do things outside of the mental health system. They may be authors, writers, teachers, what have you, you can start Googling, actually, are there people who live or nearby, or people who can do a little webinar with you and talk about sort of what their life is like and talking about their lived experience. Like Ellen Sachs, I think, is a great example. For example, here's a woman who has a diagnosis of schizophrenia and could have really jeopardized her job. As a matter of fact, decided not to tell her story till she was tenured and far enough along. She did lose some friends over it and some colleagues over it, but she continues to speak out and tell her story. How can that be an example of, again, sort of figuring out how do you disclose and what do you disclose and when do you disclose? So.
And if I could interject here, one way to consider this is to make this part of a strategic plan, because it's a culture change if it's something that hasn't been shared or disclosed at your meetings before, and maybe it's something for the board to really have a real heart-to-heart discussion about this, with in terms of a strategic planning process in a retreat, to really think about this and think about ways that you could move towards creating that environment. It doesn't happen overnight, and the last thing you want to do is alienate people because they're sharing their story and their experience. And I think it's a fine balance between the two, but I think there are some excellent examples throughout the state of boards and commissions that feel comfortable in terms of people disclosing their role in that. So I think it's something for the boards to really think about and consider that. I think it's an opportunity to really consider those things.
So have folks ever asked the people who are coming to the meetings and giving public comment and speaking from their lived experiences of maybe consumers to either, number one, invite them to or give their name to the Board of Supervisors as someone that could be on the board, and or find out if they're not interested, why they're not interested. I come to the meeting, well, I don't want to sit on the board. I don't want anybody knowing about me in that way or whatever. Have you gotten any feedback from the public about their involvement?
I don't think we've really had we've started to touch on the subject of board composition just in a couple recent meetings, and or when it comes up to time for DHCS to recruit for new membership. And I think we need to actually agendize a discussion around this, because one of the things we discuss in our small group is that it's difficult to recruit. It's hard. Recruiting is a tough challenge regardless. And my experience with boards and commissions is often the recruiting can be done by board members looking out into their communities. But if we don't know what seat we're recruiting for, that it puts a little damper on our ability to be successful. And I think also that would help us in terms of conversing with the public that shows up and or recruiting them.
Sure.
But we have to talk about this, I think, with the board. At the same time, I made a note to ask Samantha to agenda.
I mean, I appreciate, too, that you've taken a stance of, not making public, for example, on the website and so forth, who's who, but definitely I think it's important to make public the percentages. So if it's 20% people with lived experience, 20% family members, going ahead and making that public. So, again, we struggle with this. I'll just give an example. It's a nonprofit, but for Project Return, we have to have 75% people with lived experience on our board. And that means not family members, but consumers, 75%, which is like, okay, where are we going to find all these people? And we had the same issue about people worried about, well, what happens if people know? Are you going to print my name? And I said, no, just check it off. We put it in a file, and we just report whether or not we've met the obligation of having 75%. We report it to the board so that the board knows if we're looking for recruitment, what kind of demographics do we need to consider in the recruitment process. And then we work really diligently at creating opportunities for people to, again, and I know we're peer run, so it makes it a little bit easier, but we get a lot of people who are in the community as bankers and lawyers and judges and so forth, and how do we make it safe for them to be able to talk about that lived experience related to, we might even be doing advocacy on a particular issue. So what goes in our meeting minutes? By the way, what does go in the local mental health board? Everything, or what goes in the meeting minutes of a board meeting? Yeah.
That would not go.
Okay.
I think it's usually It's very basic, related to the agenda, probably.
Yeah. Okay.
Who spoke, any decisions made. Generally, public comment is captured, correct?
Yes, it's not necessarily, Sue Smith said,
Correct.
The issue of blah, blah, blah. Right.
Right.
Something else to consider just in terms of the recruitment around bringing in people of lived experience also is to think about, and I served on boards also of other nonprofits, and is think about a way to, for them to either buddy up or be able to kind of foster them, support them in terms of coming to meetings, in terms of having someone to talk to, and it just sort of kind of making that a welcoming process too. Sometimes going into a board or commission meeting can be a little bit intimidating, and I know I've sat in many as a staff person, and sat along Suzanne and many in another county, and so I think just sort of, those sort of practical welcoming things when you do recruit somebody new, that they know they're welcome and have a role to serve.
Right. And I also think counting on other roles in their life, that meaning a person with lived experience is not just a person with lived experience. They've got lots of skills and abilities that they could bring to round out needed expertise on your board. So if folks know that and know that, wow, I'm just not the quote-unquote, oh, it's just because I have a mental illness, well, thanks, but wow, you really want me because I know a lot about legislature, I know a lot about Robert's rules or policies or whatever. That's an exquisite way to think about it, yeah.
Or I just really care about my community.
Yeah.
That's a really important thing, too.
Okay, we're going to skip through. Okay, so we're going to look at, oops. Okay, yeah, all right, strategies for being effective. So we've just talked about some essential strategies, which is recruitment and now we'll say retention of membership. So we've already talked about a couple of challenges and solutions. Some other things to do to make meetings successful, of course, is to have an agenda, maybe to calendar out what you're going to be covering during the year, checklist, establishing your goals and objectives, and I would also say reviewing those goals and objectives in a timely manner so that they don't get too far away ahead of you and then suddenly now people don't want to come back to the board. You've just lost people. And then if you don't have your bylaws, establishing bylaws and policies and some procedures. And most importantly, honoring dialogue and deliberation, which Robert's rules can help with this, but of course, there are going to be times when things seem to go around and around and around. Does that happen? No?
Oh, yeah.
Okay. I've seen some board meetings where it just seems to go on infinitum, and it's like, okay, what just happened? Okay. So let's look at a little scenario here. So Jack invited Jill to go up the hill and attend the local mental health board meeting. Jill was really excited to attend, and after she got her Arrowhead water, she sat in anticipation. Looking around the room, Jill noticed that there were no name tags, the meeting seemed a bit disorganized, and people were talking over one another. So Jill decided to bounce, which means leave. So she went back down the hill, and she left without Jack. So here we go. So what are some strategies? So first of all, what are some problems here? What do you think some of the challenges are here? Pretty clear. Yeah. Anybody?
We do some of these things right. We actually have name tags.
Yay.
We have sign-ins. We have. We always have documents related to the meeting. We all, I believe, we always do introductions of everyone there, including a little bit. I think people say their role. Now I'm getting a little fuzzy. All the meetings, public and the board members, everyone's introduced.
Mm-hmm.
And we have agendas. We do have agendas. We're pretty good about starting right on the dot and ending. We try and end on time too.
Okay. All right. So this one, you don't have Jill come into your meeting and experience any of this stuff. She's kind of happy. She doesn't leave. In other words. What happens? What?
I said, yeah, well, water.
Yeah. Well, okay. Yeah. No. We're in California. Ooh.
Open it up to.
Sure. Yeah.
We're going to open it up.
Going to open up.
Yes.
Yeah.
Oh, yes. I think in this scenario, definitely the disorganization and the people talking over each other. So if you don't have a strong chair who can kind of guide people in the right way, I could see where I'd want to leave too.
Okay. Great, thank you.
I can add another experience I've had as a staff member participating in meetings is when something comes on public comment that's a very challenging issue that's not agendized on the board, on the meeting, so the Brown Act says that we can't really take action on those types of things. But that can be, and it's important information to be shared by the public, but that can sort of, how that is handled in the meeting is really important, that there's an opportunity to be heard, but that the board doesn't sort of get derailed for the rest of the meeting. Is that a fair comment? Has anyone's experienced that?
You know, I forgot about the Brown Act saying that you're really not supposed to go in depth on an item that's not on the agenda. So we do need to do better about when new issues are raised, entertaining the topic, but moving the topic to an agenda item in an upcoming agenda rather than taking any action. I think we need to make sure we don't take action on things that come up and are not agenda items.
Great. So we just covered some of these things. There are also some other strategies, and I think Marcia, I don't know how to pronounce her name, but she'll tell us. Marcia talked about developing goals and objectives, having a chair who's able to lead a meeting, establishing the expectations, translating the work plan for the board and committees, and that the work plan is primarily a tool to anticipate matters and track matters at the board and standing committee levels. And I think, again, if you have people who are in the public bringing up stuff that you were just talking about with the Brown Act, how do you keep track of, they brought it up in this meeting, how does it get on an agenda, or sort of close that loop of getting the feedback and then closing the loop that you've done something with that feedback. So the agenda should align with roles and responsibilities, and board work plan along with the board goals to provide the benchmark for the annual evaluation of the board. Okay. So here's some other things. Got a whole long list of stuff. Okay. Don't know that we need to go through all of those. So you want to manage your time, but I hear that this is happening fairly well. You're managing time, managing discussions well. The agendas are staying on topic. Now, some of the things I've noticed is there can be people who just dominate. You know, what kind of body language are you looking for to help with ensuring that people who speak often don't dominate, and other people who may be a little bit more quiet have the opportunity to speak up? So, for example, as a facilitation tool, in general, I don't like to call on people who don't speak up because they may not be comfortable, and if I go, hey, you know, blah, 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 I haven't heard from you, it sort of shines a light on that person, which they may not be ready for. But how do you help that process? Yeah. Alice?
I actually had kind of the flip side on that, and a little bit on the self-disclosure. I've had some concerns in our meetings when people are telling stories about things they encounter in their work, and they're disclosing a lot about other clients. You know, I have this client that does this, that, and the other, and the details go on and on and on and on. And I personally am not comfortable with someone self-disclosing for someone else. You know, so I actually, after one meeting where I was particularly uncomfortable, talked to the person and said, I don't think this is okay in this public forum. So, you know, I think we need to, and that actually dominates.
Yeah.
When you have people in meetings that are telling personal stories or anecdotes, or, you know, that tends to derail a meeting. Everyone gets very emotional when you have those kind of stories, whether we you know, talk about it or not. It does grab attention, and so I think we need to balance. I think we really need to have lived experience, but we need to not overwhelm boards with, you know, stories of tragedies and things that bring in agendas that are not part of our mission. Or I think we talk a lot sometimes about national stories rather than what is true in our community too.
And so when you have people also who can go on and on about their personal story, if it's a lived experience story, for example, I I think one of the things I've noticed is that sometimes that means they're not having opportunities to be heard other places. And so when they have the opportunity to be heard, they take the time to be heard. So I think it's a great idea. How do you, go talk with somebody, maybe when you have a little bit of time when it's not during the board meeting time, so it doesn't get part of the public discussion, so that they have that opportunity to be heard, because sometimes that's all they're looking for.
And I would add to that is that really effective facilitation by the chair or whoever is facilitating the meeting, maybe the vice chair, because and it's a skill and an art, and it's a skill and sort of that, because to allow the important comments to be made, and also to, as you said, to not derail the entire meeting, and it's challenging, and sort of being mindful of that.
Okay, we have a great guy on our national board that for his committee meetings, he gives everyone, it's the policy committee, which of course at the federal level we have lots of policy, and some of it, especially within NAMI, some of us agree on, some of us we don't, but we have a policy platform we're supposed to follow. So people want to speak from emotion as well as try to address the policy platform, which means they could take a long time. And with all the people on the committee, what he does is he says everybody gets 2 minutes. And in 2 minutes, you need to figure out what part of the personal part or the emotional part do you want to discuss, what part of the policy part do you want to discuss. He does a round robin for anybody who wants to do it, gives them 2 minutes, and then he kind of moves on and taking those core kernels to move on. I think it's a great facilitation technique. Okay, so if you have committees, these are some, get some value out of committees. Watching our time. I'm trying to be mindful of our time as well. Can't see that far. Okay. Any questions here? Yeah.
Yeah. Something that comes up every so often is with committees, that to what extent you have to follow the ground in having committee meetings. I mean, sometimes getting people together is bad enough. Publicizing is worse.
So let's look at that. Well,
My understanding is that committee meetings also come under the Brown Act.
Yes.
Yeah, and so that means agendas and that sort of thing. So you're right, it does make it more work, and also an opportunity for public comment in those meetings too, and recognizing that you are all volunteers too, in terms of meetings at the time outside of your other obligations. It's challenging.
So are you saying that the executive committee is going to need to talk about what's on the agenda for the next meeting, that has it has to be published, or, like, you're not saying that, are you? Because that's not a forum.
yes. So if you and your ad hoc committee.
I think, yeah, that's kind of one main thing. Yeah.
I know. These are membership committees. Right.
Some counties, through their board of supervisors and their staff, do trainings around the Brown Act for all of their commissions. I don't know if Marin did that. Did Marin do that? And so maybe a refresher in that would be really helpful for the group to kind of ask one of these really specific questions. It might be something to consider. And I think also the difference between standing and ad hoc too, when there's a special need or a special project or something that you're working on and for a short period of time. Yeah.
And there's one other thing to be really careful of, and that is if you all are emailing each other
Yes.
and discussing something, that technically, if you have quorum and above, is a meeting.
Thank you. I was gonna raise that issue also, and I think we probably need to look a little bit more and make some distinctions, because when the executive committee meets with the mental health director to establish the agenda, my understanding is that's not subject to the Brown Act. But if the executive committee has meetings, holds meetings to discuss particular items, that is subject. So that's
Okay.
my understanding.
Great. Thank you.
Thank you. That's a very important distinction, because that's true.
All right. sounds like maybe you all have this one down, but again, when you get in those interesting situations where people may be talking a little bit too much or dominating conversation or things become a little disorganized, of course, listening is your best friend, and to practice active listening. Does everybody know what active listening is? Yeah? Okay. Yeah, okay. Well, you know what? It's kind of funny. We think yes. So there are a lot of times, does everybody know what recovery is? Yes, and then, you know, people don't know what it is. So I always just double check, of course, ensuring that you've confirmed and heard what the person is saying, you know, just by maybe repeating it back and asking for confirmation. Is that what I heard? I just want to make sure we're on the same page, sort of thing. So, okay. And of course, ensuring that relationships are the first priority, and when emotions get really high, helping people to come back to the facts or the issues. And of course not attacking people personally, working together to find solutions, being willing to negotiate, and I always say, of course, being okay to, it's okay that if we can agree to disagree. Okay. So who are you going to call when you need, maybe talk a little bit about these, maybe some extra information or want to utilize some of these great resources. So is everybody familiar with these? I can go through them. You know, you have your, of course, your California Association of Local Mental Health Boards and Commissions. We gave you the Welfare and Institution Code website for California and other California law.
The Planning Council.
The Planning Council. Okay, and everybody familiar with what the Planning Council is? Yes, no, no. Okay, so the Planning Council, basically it advocates for children, adults, older adults with serious emotional disturbances or serious mental illnesses. It provides oversight and accountability for the public mental health system, and it provides advice to the administration and legislature on priority issues and participates in the statewide plan. So they're also the group that's going to help with the data toolbook. What is it? Where are they called? Data notebook. Okay.
And I know you serve on the CON board, and I've seen you at meetings.
Okay. And California Institute of Mental Health, is that the next one?
CiMH, right.
Anybody know what that is? What is that?
California Institute of Mental Health, which is my employer, and CiMH is a statewide nonprofit that works closely with California's public mental health system, providing training and technical assistance with a lot of focus on evidence-based practices work, doing workforce development projects, and also advocating and doing policy dissemination and work, and doing a range of things. We've been doing a lot of work in the last few years supporting counties' efforts to do integration of mental health, behavioral health, and physical health care, just a snapshot of work. And so we have staff. We're headquartered in Sacramento, but we have staff throughout the state that do different projects for us. Okay. And we have big leadership development training, too, that many of you may have taken part in that.
And the California Mental Health Directors Association, we talked a little bit earlier about that, and such a great resource. The Advocacy Association representing the mental health directors from all of the California counties, and I think there are 2 or 3 cities, 2 cities maybe?
City of Berkeley, Tri-City.
Tri-City, yeah, right, okay. And then the California State Association of Counties, which its primary purpose is to represent county government before the California legislature and administrative agencies in the federal government, and they educate the public about any value or need for community programs and services, of which mental health falls under. Okay. And any questions moving forward? So these are the next trainings that are upcoming.
And these are webinars, so you'll be able to log into them and listen to them, and will be the agendas are being developed in terms of where they are. We'll be doing the next one in March 22nd, and we'll be physically doing that in San Joaquin County in Stockton. Similar type of thing here, so those local mental health boards can come in and interact. And then in May, up in Shasta County, up in Redding for the Superior region. And there's also, not listed here, is a face-to-face training coming in April in Irvine, which goes along with the CON board meeting and the Planning Council meeting. So there'll be more details on that too. You're also welcome to email Camille to get on the direct distribution list for this. We send this out to counties, and we try to have the current board liaison. Sometimes that changes, but you're welcome to just email Camille and say, hey, put me on your mailing list, and she'll be happy to keep you apprised of these things. And yeah, so those are coming up.
Those are coming up.
Right.
And when we did the poll earlier, and I asked you all what had previous mental health boards said they wish they had known, I was taking notes because we may take some of that information and actually put it in the advance. So some of the questions do have purpose, other than, Okay, so we've had lots of discussion and questions, but I'm open to more if needed. Yeah. Yeah. Anything.
Maybe, Keris, you can speak to trying to make a board more, have a clearer direction and be more goal-oriented.
I'm the biggest fan of strategic planning and retreats. And again, not retreats so that we can, well, yeah, okay, I'd do it at a spa if I could, but I don't know that the public would be very happy if you all went to a spa. But I think it's a good idea for the board to get together, maybe before the beginning of a year and take some time to think about what are the objectives, what are the goals, how do they want to achieve them, and getting that written down into a plan in order to assist with effectiveness.
Could we do that in spite of the Brown Act? Could we get together before a meeting and discuss something? That what you're suggesting?
Does a retreat fall under the Brown Act?
Yes,
it does.
Did you notice that at the regular meeting?
I mean, on one hand, so I've struggled with. There's an instance where I've struggled with this. I'm like, well, why do we have work to do, and we can't, So, but then yeah.
Because your item of business is development of a strategic plan, and then you reserve a place for open time to comment on that conversation.
But publicize.
Same, this is no such in there.
Yeah. And the other thing I was going to say to get to Robbie's question too is, creating buddy systems and mentoring systems, I think, really help with, onboarding of folks and hopefully help with retention and helping the board meetings to run a bit smoother, if they have somebody they can buddy up with. So, yes, Alice.
Yeah, for our board, I know Robbie had mentioned, we have a retreat with one of our recent board meetings, and I was really warm to the idea, partly because I, hate retreats, but more because my schedule was just so jammed. The thought of trying to go to something else additional was just no way. But looking at the fact that we need to be doing our annual report and we need to reset goals, we did talk about that a little bit on our last board meeting. But I do think it's maybe time for the board to regroup a little bit and to think about what we've learned here today and try to figure out how to be more effective, because I thought I was kind of alone with my thoughts that we were spinning our wheels. But from today, it seems like everybody else feels like, where are we going and why are we here? And half of us here are relatively new, and so you don't want your new members feeling that way. We joined, obviously we all had reasons for joining, so I kind of think we ought to think about that again and maybe move forward with having some kind of retreat where people do come and participate.
It'd be nice, even now that I'm hearing that, if maybe mid-year, the chair check in with each person individually and see how they're doing relative to why they joined, and are they feeling fulfilled and or achieving what they came to achieve. I think that'd be an interesting thing to try out. Yeah.
Do you want to open up the phone line? See if there's any other, just kind of, why don't you just unmute everybody and just kind of, Keris, want to pose a general question or questions?
Actually, I'll mute them one at a time because we don't know what's
one at a time. Okay, got it. So, Marcia?
Oh, Marcia?
Yes.
Oh, hello.
Hi. I have a question that relates to retention of board members. Our board had a discussion at our last meeting about how we get people trained, they're on the board, and then they end up having to leave because of, in our bylaws it says you can't be an employee of someone who gets money from the county, right?
Mm-hmm.
So my question is that in every board's bylaws, and is that something that's negotiable so that we're able to retain people who do get positions where they are being funded by county?
Yeah, it's in the Welfare and Institution Code as a conflict of interest. So it's very difficult to be receiving. So let's just look at it from there's a code and a regulatory reason why you don't do it, but also let's look at it from another perspective. So if somebody is earning money from the very entity that now they have to have oversight and give feedback to, it creates kind of a murky situation. So I think that's why it really makes sense not to have somebody who is receiving money on the same board that has to give feedback and make some decisions about that entity.
So even if, I know from the ethics training, you can excuse yourself from voting on something that you may have financial gain from. So couldn't that be used in those examples, or is this like it's in the WIC code and it's never going to change?
I would say that it's in the WIC code. I know that when these kind of questions came up, we would go to our county council to ask the questions, and that might be something you do, is that specifically inquire with your county council, or have your mental health director inquire with your county council, because there might be different interpretations of this, and I'm not an attorney, I'm a social worker.
Yeah. Right.
So I don't want to advise you wrongly. And I also want to honor the challenge in smaller rural counties that you don't have sort of robust community, the numbers of people perhaps to sort of fulfill all these roles as volunteers. So I understand that there's a challenge around that, but
right.
This is just one of those things that was put into the W&I code for a reason, primarily around conflict of interest, I think, too.
Okay, thank you.
Great question, though.
Thanks.
Sure.
Marty.
We have a couple of board members who, I shouldn't say that they're not board members, but they're kind of attend every meeting, they act the board meeting come up, but they're not officially board members, and they do receive funds from the state.
And that's probably a good thing because they're involved and interested, and so that's a good thing to have interested community members and contractors and and staff that are interested in what's happening. So I think that's a positive thing. All right.
All right. Anything else?
Anything else?
Going once? Going twice?
Thank you all for participating today.
Thank you very, very much.
And for everyone, both on the phone and here, this will be recorded and it will be posted on our website and probably on our YouTube channel, and we will forward that to you. So if you want to have somebody else listen to it, you're welcome to do that. It will be available. So thank you so much.
So thank you, and thank you very much for all of your service, really.
Great.
Thank you all for being here. I want to thank you all for being